Now let's dive deep into this big LGBTQ story for today. I'm Jeff Oliverio, and let's queer up health. 7 of the top 10 states with the highest STIs are in the South. Guess which one isn't? A new report from Invigor Medical, based on CDC data, is sounding the alarm, and it's hitting the South the hardest. According to their latest study, 7 of the 10 states with the highest rates of sexually transmitted infections, or STIs, are in the Southern U.S. The report looked at the 4 most commonly tracked infections: Chlamydia, Gonorrhea, Syphilis, and HIV, and how they've changed over the past decade. In 2013, the U.S. reported 1.8 million cases. By 2023, that number jumped to 2.5 million. Chlamydia led the chart with more than 1.6 million cases last year alone. But it's not all bad news, the study says. Quote, "While syphilis infections remain at record highs, reported cases of chlamydia, gonorrhea, and HIV have declined from their peak levels in previous years, signaling a promising shift in the trajectory of the nation's STD burden," end quote. Still, disparities remain stark, especially in the South. States like Louisiana, Mississippi, Alabama, North Carolina, South Carolina, and Arkansas are all in the top 10 for STI rates. According to the study, these states tend to face persistent challenges in STD prevention, including gaps in healthcare access, limited sexual education, and structural barriers to screening and treatment. Notably, Florida, a southern state, does not appear in the top 10 for highest STI rates. Outside the South, New York and South Dakota also report unusually high numbers. In South Dakota, this is linked to concentrated outbreaks in Native American communities, where systematic health inequities and limited services worsen the burden. In New York, high urban density and strong case tracking mean more reported infections, especially among gay and bisexual men and trans folks, who remain disproportionately impacted. On the flip side, New England reports the lowest STI rates in the country. Vermont, New Hampshire, and Maine sit at the bottom of the list. Invigor Medical writes, quote, "New England states tend to be older and less ethnically diverse, both of which are associated with lower STD risk. Higher incomes and lower uninsured rates also make it easier to access testing and treatment," end quote. The data also shows that Black Americans experience STI rates over 7 times higher than white Americans, and young women, especially under 25, are at the highest risk, largely due to elevated chlamydia rates. As we head deeper into summer, a season known for fun, sun, and hookups, health experts are urging folks, especially in high-risk areas, to get tested, stay informed, and use prevention tools like condoms and PrEP. You know, the story of, the silver lining in the story was saying, again, that all the news was not negative, but again, we're looking backwards on these numbers, and all we're seeing now is cuts to healthcare, cuts to education, cuts to programs that are designed to have, sexual education in schools completely being eliminated in favor of abstinence, which is, of course, not a great method for, and any generation has ever been a method. So I'm fearful that we're going to see a spike, and as people lose healthcare, it's just going to exacerbate with people who either are maybe even on things like, again, HIV medication to be undetectable. When you lose healthcare, all those things are just going to cause the healthcare system to have greater burden by people getting sicker and having more diseases.
Yeah. You can't manage HIV in the emergency room.
No.
I mean,
it's too late.
Yeah, this has potential to be a nightmare. And when you have prudishness involved, that is always the enemy of progress. These southern states are also the most religious states. They are also the most conservative states. They're the red states. They have the most teen pregnancies. They have the most they have the most sexually transmitted infections. They usually have the lowest incomes. I mean, their anti-progressive views keep them from progressing. And so until we get some empathy, some education, some fact-based values rather than just, whatever, this isn't going to get better.
No, I mean, the first thing I thought about, the same thing, this is all the Bible Belt. They're on their knees. They're definitely not praying,
right.
And it's a shame that they don't learn. It keeps repeating itself over and over. And you have to progress and just kind of accept things and kind of educate people.
And you shouldn't have to be burdened with shame, and you shouldn't have to get sick or die. Like, yeah, you can be sexual. We're sexual people, but you can also be smart, and you can be healthy, and you can care about other people, and you can be properly educated. We are not only not as empathetic or compassionate as just good people should want to be, we are afraid of education. We are afraid of knowledge. We are afraid of facts. I don't know what's happened. I think I do. I mean, there's this 40-year effort to get us where we are, and we watched it happen, we allowed it to happen. But be that as it may, now here we are, and really people's lives are at risk and it's their ideology, but the reason they defund programs is because they see these programs are about ideologies. Freedom, justice, civil rights, health, these aren't ideologies. This is about making people's lives good, but because it interferes with their religiosity or whatever, then they oppose it.
But sex is one of the most important subjects to talk to your kids and any kids about in general to help educate them. And that's the one thing our country is so backwards on in educating our people. And people are afraid to talk about sex. It's going to happen either way. So
yes,
educate the kids, help them, choose the right decisions or make the right decisions.
Yeah, because keep it zipped has never worked.
No, and I fear most of the states, again, in this list, of course, are states that have a high African American population as well. And of course, again, the church has not been helpful to the cause of sexual education, of talking about the LGBTQ community, of course, especially in the conservative Baptist church. And the problem is you're seeing these rates of HIV go up in Black communities because, they're fearful of testing. They don't want to, there's a stigma around taking medication for something which can be prevented. And, I see the church as a place that should be out there educating to protect their parishioners and giving them some type of education because, again, people are going to die. And you can't, God is not going to save you from HIV, unfortunately.
I can tell you, if you're ever in the area and you want to stop by, even for a drink of water or to use the bathroom at Sunshine Cathedral, every bathroom on this property has condoms and dental dams.
Very important.
So that is a big LGBTQ story and a little plug for today. There is no other queer nonprofit media platform like this in the entire world. Support our LGBTQ stories by subscribing and sharing Queer News Tonight.